Welcome to UMCC Medical Consultant Connectors, where your health matters to us. When medications harm, drugs and psychiatric disorders. We take drugs to feel better, we trust medications to heal, but sometimes the very substances meant to improve our health can have unintended consequences. This is especially true when it comes to psychiatric medications and their potential to cause or worsen mental health conditions. While these medications can be life-saving for many, it's crucial to understand that all drugs come with risks. Some individuals may experience adverse effects, including psychiatric symptoms, as a side effect of certain medications. These effects can range from mild and temporary to severe and long-lasting. This essay explores the complex relationship between certain medications and the development of psychiatric disorders. We'll delve into how different classes of drugs can contribute to conditions like depression, psychosis, and anxiety. Understanding these potential risks is essential for both patients and healthcare providers. Informed decision-making about medication use requires a careful balance of potential benefits and risks. The weight of withdrawal depression from drugs. Depression, a mood disorder characterized by persistent sadness, can be triggered by certain medications. Withdrawal from some drugs significantly impacts mood. Stimulants prescribed for ADHD can trigger depression when stopped abruptly. These medications increase brain chemicals regulating attention. Abruptly stopping them can cause a chemical imbalance leading to depression. Corticosteroids used for inflammation are also linked to depression. Long-term use can disrupt serotonin, affecting mood. This disruption contributes to depression during prolonged treatment. Toxic triggers. Drugs that can cause psychosis. Psychosis, a severe mental state characterized by a loss of touch with reality, can be a terrifying experience. While various factors contribute to psychosis, including genetic predisposition and environmental stressors, certain medications can also play a role in triggering this condition. One class of drugs known to have psychotomimetic effects, meaning they can mimic the symptoms of psychosis, are hallucinogens. Hallucinogens, such as LSD and PCP, directly affect neurotransmitters in the brain, particularly serotonin, leading to altered perceptions, hallucinations, and delusional thinking. While these effects are often temporary, they can be intense and disturbing, potentially triggering a psychotic episode in susceptible individuals. Another class of drugs implicated in drug-induced psychosis is stimulants, particularly in high doses or with prolonged use. Stimulants, by increasing dopamine levels in the brain, can disrupt normal thought processes and perception. In some cases, this overstimulation can lead to paranoia, hallucinations, and delusions, mimicking the symptoms of psychosis. Section 4. The anxiety paradox: medications that can increase unease. Anxiety is a common human experience. However, when it becomes persistent, it can interfere with daily life. Paradoxically, some medications can exacerbate anxiety symptoms. Asthma medications, especially those with beta agonists, can increase anxiety. Beta agonists stimulate the central nervous system, causing nervousness and restlessness. Decongestants, used for colds and allergies, can also stimulate the central nervous system. This can lead to increased anxiety, restlessness, and insomnia. Section 5. Examples and awareness. A call for informed choices. It's crucial to remember that the development of psychiatric symptoms from medication use is complex and varies greatly from person to person. Factors such as genetics, personal history of mental health conditions, dosage, and duration of medication use all play a role. Here are some specific examples of drugs that fall into the classes discussed. Stimulants like Adderall and Ritalin, used for ADHD. Corticosteroids such as prednisone and dexamethasone, used for inflammation. Hallucinogens like LSD and PCP, often associated with recreational drug use. Asthma medications such as albuterol and salmeterol, used to treat asthma. And decongestants like pseudoephedrine and phenylephrine, found in over-the-counter cold medications. Awareness is key. If you're experiencing any unusual or concerning mental health symptoms after starting or stopping a new medication, it's essential to consult with your doctor immediately. Open communication between patients and healthcare providers is paramount when it comes to managing medications and ensuring overall well-being. UMCC, your ultimate medical consultant connectors.